Welcome to today's lecture where we're going to be looking at endocrine pathology. And the big one that we want to concentrate on is going to be diabetes mellitus. And this is because it's a very common pathology that we're seeing these days. And if we break up the term, dia is going to mean to pass through, like diarrhea. And the betes is going to be to siphon. And mellitus means to be sweetened with honey. So altogether, what this means is it's going to translate to sweet pea. And because there's so much sugar or glucose in our blood, it's literally going to make your urine taste sweet. And that used to be one of the symptoms that you could be diagnosed with. The doctor would be able to smell or taste the sweetness of the urine. So really, it's going to be a group of disorders that are all going to be resulting from hyperglycemia. Again, hyper is going to mean excessive, glyc is going to be for glucose or sugar, and emia is going to be blood. Like I was saying, it's very common that you see now these days, with 29 million Americans are going to be suffering with type 2 diabetes, while 1 million suffer from type 1. And we'll look a little later on the distinction between these two different types. But it's going to have an extreme cost on the healthcare system, and that's through hospitalizations, medicine, as well as loss of productivity at work. So you're looking at $245 billion a year in direct and indirect care expenses. So if you remember from our endocrine lecture, what's going to happen is all the cells in our body need glucose to produce ATP. So the way glucose gets into the cells is insulin, which is going to be released by the pancreas here, is going to be what allows the glucose to pass through all of the cell membranes. So diabetes then is going to develop when either insulin's in a short supply or the receptors on all the body cells are no longer sensitive to insulin. So they're not going to let the glucose pass through. But a lot of times it's going to be both of these instead of one or the other. So if we kind of take a look here, we can see again, if these beta cells in the pancreas fail to work, obviously less beta cells is going to mean less insulin for the body to use. So that's one way. If we kind of zoom in on the receptors on the cells here, normally the way the insulin receptor works is insulin is going to be released into the blood, and it's going to attach itself to the insulin receptors on the cell. Once it attaches to the receptor, it's going to have secondary pathway effects on the glucose transporter in purple here. And once that's activated, a pore is going to open up, and this is going to allow glucose to travel from an area of high concentration to low concentration and enter into the body cells. And from there, it's going to go to the mitochondria, or it's going to go through glycolysis and produce ATP. What's going to happen, though, with diabetes is we'll still send the receptor onto this cell, but no longer is the glucose transporter sensitive. So the pore is not going to open, and glucose is going to continue to accumulate within the blood. And this is going to what leads to hyperglycemia. And we'll look at the downstream effects of having too much glucose in the blood then. As I was saying, there's two different types. So with type 1, this is going to be an autoimmune disorder where our own immune system's attacking those beta cells within the pancreas. Basically, you're going to have very little to no beta cells after a certain age, so your body's going to produce no insulin whatsoever. Whereas with type 2, this is going to be acquired. This is the one where is much more common, and this has to do with diet and lifestyle. So if we're constantly ingesting and taking in too much sugary foods, we're going to increase the glucose in our blood, and that's going to have deleterious effects on the pancreas as well as those receptors cause insulin resistance. And with type 2, pre-diabetes is just going to be a situation where you're building up to eventually develop full-blown diabetes. And so basically it doesn't happen overnight. Over years of improper diet or lifestyle, your blood glucose levels are going to get higher than normal. And 79 million Americans, or 35% of all adults, might be pre-diabetic. So this is where you're overweight, becoming obese, or at that point, and if you stay there, things are going to get worse over time. So some of the risk factors for type 2 are age, 45 years and older, whether you're 20% or more over a healthy weight, if it's a family history or certain ethnicities or have a higher predisposition, including Native Americans, Hispanics, Pacific Islanders, Asians, and Black. Hypertension is going to go along with that. Gestational diabetes, gestational meaning during pregnancy. And if you also suffer from something called polycystic ovarian syndrome, the hormones involved in that are also going to be part of diabetes. So if we look at the complications of what happens when you have too much blood sugar in the system, really these are going to be very serious. They can be life-threatening if they are there for too long. So they're going to affect the cardiovascular system, where it can cause atherosclerosis, where you have a hardening of the arteries, which we'll look at more in the cardiovascular system. Basically, we've all heard you can develop plaques within the cardiovascular system. So again, you're thinking of the blood vessels as basically plumbing of the body. And what's going to happen is you're going to form these plaques. You're going to narrow the size of the tube, and this is going to raise blood pressure, which has its own downstream effects. And you can cause things that can lead to stroke or an aneurysm where the vessel actually bursts as well. It's also going to lead to edema. If you remember, edema means swelling. So what's going to happen is you're going to have poor circulatory return. So when these vessels become damaged, the blood's not going to flow so easily through them. So here we can kind of zoom in on a blood vessel. Here we have epithelial cells on the inside, and the basement membrane is going to make the borders of the outside of the cell. So what's going to happen with diabetes is that basement membrane is going to become thicker. So normally, the plasma and blood flows normally through the vessel with no problem. But as you have diabetes, we said that the walls of the vessels become thicker, and this is going to allow them to become leakier as well. So we're going to add some damage to those blood vessels, and instead of the plasma, which is the fluid that carries the blood cells, going straight through, it's not going to be able to leak out to the sides, and that's what's going to cause the swelling. Other complications is because of this lack of blood flow, the cells aren't getting the nutrients that they need, whether that's oxygen or glucose. And what's going to happen, since nerve cells are going to rely on those to stay healthy, if we starve them of oxygen and glucose, they're now going to suffer damage as well. And with nerve damage, you can have a lack of feeling. And if you can't feel the condition of your body, if you get a wound, it's going to go unnoticed and you're not going to take care of it. And because of that, it's going to end up becoming infected as well. So once a wound's infected, bacteria is going to get in and you run the risk of gangrene, where the tissue can end up dying or leading to more serious cases like sepsis, which also is not very good. And because of this also lack of blood flow, wounds aren't going to heal nearly as easily. Basically, a small wound could stay open for a long time because we just don't have the nutrients or the blood supply that we need to get it to heal properly. And because of this, what can happen is it leads to amputation. You just can't save the tissue after so long. And so what's going to happen is we'll just have to amputate the area to try to save the rest of the limb. So a lot of times you'll see it might start with a couple toes that they'll amputate. And eventually from there, it's just going to get worse, where they might take off half the foot, the whole foot, the entire lower leg, just trying to keep the sepsis from being life-threatening. So it's very common to see amputations within diabetics. I was also watching, PBS just has a new documentary called Blood Sugar Rising, and one of the doctors was saying because there's so much glucose in the body, it comes out onto the skin as well through some of the pores. So this allows for fungus and yeast to kind of live more easily. So he was saying athlete's foot becomes a problem as well. So you'll have kind of chronic athlete's foot. That in itself leads to skin damage, which can cause wounds, which can then lead to this problems we saw right here. And obviously amputations are not good. Along with this, whenever we have nerve damage at the peripheral nerves, we're going to call it neuropathy or peripheral neuropathy. And that means it can either be the motor nerves as well as the autonomic nerves. So this can either mean tingling, pain, or numbness. Which one of these it is, it's just kind of random, I feel like. But definitely peripheral neuropathy with pain is going to be a big issue because it's really hard to treat chronic nerve pain like that. But even worse, if it gets to the autonomic nervous system, as we saw, things like the vagus nerve, which is going to innervate all the different organs of the body, now you're going to have organ problems because the nerves aren't telling those organs what to do properly. So you can have blood pressure issues, digestive issues, impotence. Basically anything the autonomic nervous system is involved in, you could have a problem with. Looking at the signs and symptoms then, there's going to be three major ones that are really indicative of diabetes. The first one's going to be something called polyuria, which means increased urination. And what happens is because we have so much glucose in the bloodstream, the kidneys are going to try to eliminate that through the urinary system. And where there's a lot of glucose, there's also going to be a lot of water. Because just how water likes to follow salt, the same thing is going to be true for glucose. Water is going to want to follow the glucose out of the body as well. So this is going to create a dehydrated state with all the urine that we're losing. And because of this, the hypothalamus is going to sense it, and it's going to increase your thirst. So that's going to lead to something called polydipsia, where you're just going to feel constantly thirsty. You're going to be peeing a lot and drinking a lot. And then the third one's going to be increased appetite or polyphagia. Again, phagia is going to mean appetite or eating. And the reason this is because we have so much glucose in the blood and it's not getting into the cells. The cells aren't getting the energy they need, so your brain's going to feel like it's in this kind of starving state because it's not getting any of the energy from its food. So it's going to think it needs to eat more to kind of make up for that. So that's going to be kind of a positive feedback loop that isn't going to be great. But there's also going to be many other signs and symptoms as well. Fatigue, blurred vision, as we damage those tiny blood vessels, especially in the eye, they're going to cause blurred vision. And like we said, the pee is going to taste like sugar as well. Sometimes you'll see people, they'll see that there's pee around the toilet and it starts to crystallize. That's one of the first signs that makes them realize what's going on. There's also some diabetic emergencies that are important to know about. The first two are going to be from a lack of insulin or too much blood sugar. So the first one's ketoacidosis, and this is going to be caused by a shortage of insulin or lack of glucose in the cells. And because those cells aren't able to develop energy, they're going to go to other systems in the body to try to make up for that energy. So what it's going to do, it's going to metabolize those lipids or those fats that we store in our fat cells. So you're basically going to break down fat and try to get the energy that we stored there. And the byproducts of this process are going to be acidic. So the body's going to become acidic due to this. Very closely associated with ketoacidosis is something called hyperosmolarity, again caused by a shortage of insulin, but it's going to cause a rapid extreme change in pH, and this leads to shock, coma, or death. So this is much more serious. And the opposite is going to be if we have too much insulin circling around, blood glucose is going to become dangerously low. And if we don't have any glucose getting to the cells, obviously the cells are going to end up dying, and that could lead to terrible things. Those are going to include some of the symptoms of dizziness, confusion, weakness, or tremors. So sometimes they might say someone looks like they're acting drunk or loopy, could be on their way to insulin shock. But again, this can lead to death or coma. What's important to know, if you know somebody's diabetic and you ever come across them and they're not responding and you don't know if their blood sugar is too high or too low, you never want to give somebody insulin. Because if you were to give them insulin, the blood sugar would become too low and they could die. Whereas if they have passed out, what you want to do is you want to first give them some sort of simple sugar, like orange juice or something easily digestible, because if their blood sugar is too low, that will make them come out. Whereas if it was too high and you gave them a little bit more blood sugar, it wouldn't be nearly as life-threatening if you did the opposite and gave them insulin when they didn't need it. So you'd always want to give them sugar and not insulin if you were unsure of the situation. But the treatment goal for diabetes obviously depends if it's type 1 or type 2, but you want to improve insulin production, inhibit sugar release from the liver, increase insulin sensitivity, and decrease absorption of carbs in the small intestines, carbs being where the glucose is coming from. So with type 1 treatment, because the pancreas isn't working, you're always going to need to be on some sort of insulin, whether that's through injection or they can install a pump directly into the body where it automatically gives you insulin. Much more simple. When it comes to massage, if somebody has an insulin pump, they'll let you know what kind of positioning can and cannot work. Typically, there's not much problems with that I've seen with the couple I've worked on. With type 2, the big thing is going to be a change in diet and lifestyle. So that's going to include eating less sugary meals to watch your insulin levels or glucose levels, and exercise, as muscles are going to be more sensitive to insulin. So again, you might end up with an insulin injection or pump, and because you are going to eventually damage those blood vessels, the kidneys are going to suffer the brunt of that, and you're going to end up on kidney support or dialysis, and eventually you probably need a kidney transplant. So as far as massage therapy indications, you want to be aware of things like skin health. If they have any cuts or wounds, you don't want to obviously go over them. Be careful around the injection or pump sites. Sometimes their fingers might be sensitive from always pricking them. They'll let you know. And then if they have some sort of neuropathy, you'd have to judge it, where if they don't have a good sense of pressure, you wouldn't want to use deep tissue because they couldn't report back if it was too much. As far as the benefits, if they're well managed, people with diabetes are going to enjoy the same benefits of everyone else. Basically, if they have more serious problems like cardiovascular disease because of it or kidney disease, then you're going to have to work within their adaptive capacity and probably work more closely with the doctor just to be careful. The next group of pathologies are going to have to do with the thyroid, and in particular, if it's working too much or too little. So when the thyroid's overproducing hormones, we're going to call this hyperthyroidism. And when they release too much of those T3 and T4 hormones, it's going to stimulate metabolism. So about 1% of the US population at some point is going to have a form of hyperthyroidism, but it can affect any age. And the major one that we see is something called Graves' disease, and that's going to be most common in people aged between 20 and 40 years old. And a lot of times you're going to develop a goiter in the neck we'll look at. But there's going to be three main causes of hyperthyroidism. Again, it could be autoimmune, where the immune system's attacking the thyroid itself. There's going to be a development of thyroid nodules are going to become hyperactive, meaning they're releasing too much hormone, or the whole thyroid become inflamed as well. So eventually the body's going to be overwhelmed with these pro-metabolism hormones. This can lead to things like high heart rate, high blood pressure, high respiratory rate, and digestions all speed up. So basically your body's just working faster than it normally would. And that could possibly lead to something called arrhythmia, where your heart beats out of rhythm. And that can also lead to stroke as clots build up in the heart. So here again, we can see this is our hypothalamus and pituitary up here. And it's sending its signal to the thyroid in the form of TSH, or that thyroid stimulating hormone. So in hyperthyroidism, what's going to happen is the TSH is going to drop, because basically this thyroid's overproducing its T3 and T4. So the pituitary is thinking, I did my job. We don't need to stimulate this thyroid anymore. So we're going to stop sending TSH. But even with TSH stopped, the thyroid's still going to produce those hormones all on its own because it's diseased. So to test for it, if you see high levels of T3 and T4, that's indicative of a hyperthyroidism. But what's going to happen is the conversion of fuel to energy increases 60 to 100%. So you've almost doubled your how much energy you're burning in the body. So the complications could be osteoporosis, eye problems, rashes on the legs and feet, swollen skin around the nails, pregnancy complications, and then damage to the heart and major blood vessels or heart failure, again from that high blood pressure. There's going to be different types of hyperthyroidism. We're really going to look at Graves' disease. Again, Graves' disease is going to be that autoimmune, and this is when antibodies are attacking the thyroid. It's going to cause the thyroid to grow, and it's going to secrete excessive hormones because of that. So risk factors, stress could be one. X-ray exposures to the neck, so people getting cancer treatment, or you might have to get X-rays in this area of the body, can affect the DNA of those thyroid cells and cause them to overgrow, or certain antiviral medications as well. So when we talked about a goiter, this is what a goiter can look like. This is a rather large one. But as that thyroid tissue grows, because the thyroid's in the neck, you're going to see kind of a bulging within that area as it grows. So it's just an accumulation of small thyroid nodules. And because there's more and they're larger, they're going to produce excessive hormones. And they can also kind of press on the trachea and the esophagus as well. Thyroiditis, again, itis is inflammation. So this is just simply inflammation of the thyroid. And this would be temporary hyperactivity, so a temporary type of hyperthyroidism. This could be caused from a viral infection or sometimes a complication of childbirth, probably because of hormones, I'm guessing. Toxis adenomia. This is going to be when you have development of benign tumor or nodule, and this is going to be related to iodine deficiency. So the way the thyroid creates the hormones T3 and T4 is it's going to need iodine as part of that process. So because we have iodine in our diet through iodized salt, it's rarely seen in the US or first world countries because we supplement with iodine and salts basically in everything we eat. So it's rare to see that. But the signs and symptoms, again, think everything's kind of hyperactive. So you're seeing an increase in heartbeat or heart rate, tremors, you'd have shakiness, increased perspiration or always feel hot, frequent bowel movements, skeletal muscles are going to become weak, light or missing menstrual periods. Again, as we see in the reproductive system, anytime your menstrual cycle becomes abnormal when it's usually normal, you want to find out why. There's many different reasons. Things like dry skins or brittle nails. Another big one is protruding eyes. Your eyes are going to kind of look bug-eyed, as we see in this picture here, as well as the classic goiter in the neck. So doctors when you get a checkup, they'll always feel around here. Along with feeling lymph nodes, they'll feel for that thyroid. So treatment, again, it's going to depend on the cause. They can use radioactive iodine. What's nice about the thyroid is it's really the only part of the body that uses iodine or takes it, uptakes it. So you can send a radioactive iodine to the body, and it's going to concentrate itself in the thyroid and destroy those basically thyroid cells. Certain meds can limit thyroid activity. Beta blockers are used to bring your heart rate back down to normal. And you can remove the thyroid with a thyroidectomy. And because we can we have medications that are supplements for those hormones that the thyroid produces, you can live a normal life without a thyroid. You'll just be on the hormonal medication. So as far as missound indications, again, normal things like looking for skin damage would be a local caution, and you'd avoid the goiter in the neck, but we're not really doing a whole lot in that anterior compartment anyway. So benefits, especially if they're always hyperactive, it might be a nice break, try to hopefully calm them down a little bit, but massage is not going to have any profound effects on thyroid function. So overall massage will be safe, but it doesn't really affect it. The opposite of hyperthyroidism then is going to be hypothyroidism. And this is when the circulating levels of thyroid hormones are abnormally low. So it's going to be basically, you're always going to feel run down because the body's going to have difficulty generating energy from fuel. So this is more common with about 4% of the US population. And a lot of times people don't know they have it. They just feel tired and they don't know why. And women are going to suffer this more than men, but it's most common 60 years or older. Again, what's going to happen? T3 and T4 levels are going to drop. And the reason this is, the way they test for it is, TSH is going to try to stimulate that thyroid, but the thyroid's no longer responding to that stimulating signal. So the anterior pituitary is going to release more and more TSH. So here we can see T3 and T4 have very little to no response to the stimulating hormone. Because of this, we're going to have lower levels of T3 and T4. The anterior pituitary is never going to get that stop signal because the hormones don't reach it. So it's going to continue to release more and more TSH to try to stimulate that gland, and it's just not going to work. So when you go to doctors to get blood work, if they see high levels of TSH, that's indicative of hypothyroidism. Some complications, it's going to be the opposite of hyperthyroidism, where you have decreased contractibility of the heart muscle. This is going to lead to heart enlargement. Gastric stasis, where things aren't moving smoothly through the digestive system anymore. Again, irregular periods. The book says that you could have excessive periods. My wife had hypothyroidism. The reason we found out is because she didn't have a period for 3 months. She was tired for like a year straight, and she just, everyone always says, oh, I'm just tired because of work, because of that. In fact, my nickname for her used to be Nappers because she'd always take naps. Then, about a year later, we find out the reason she was so tired is because her thyroid no longer was working properly. So now she's on the medication, Synthroid. But weight gain is also very common because you're basically not utilizing any of that energy, so the body's just going to keep storing what's not being used. Again, different types of it. The most common is going to be something called Hashimoto, and that's going to be the autoimmune type. You can be born with hypothyroidism, so that'd be congenital. Idiopathic, again, means we don't know. And iodine deficiency. If you don't have enough iodine, you can't create those hormones, and that's why you would have less T3 and T4. Or if you're being treated for hyperthyroidism and you take too much of the medication to try to limit the thyroid function, you just need to find that balance. And that's going to be the main thing with any of these thyroid diseases, is finding that proper balance of supplementation that you need, which that can take years sometimes to find that right balance. So again, like we were saying, signs and symptoms: weight gain, fatigue, depression, constipation, slow heart rate, basal temperature drops, slower reflexes, swelling in the distal areas, and you can also have a goiter again. So treatment, diagnosis is going to be challenging because it can look like a lot of other things. You're going to feel depressed. You might have symptoms like fibromyalgia or chronic fatigue syndrome, and all these, especially chronic fatigue and fibromyalgia, are hard enough to diagnose on their own. So it can be comorbid with them as well. It's not always caught on blood tests, and that's what can make it so tough. You can do an ultrasound like you see in this picture, where they can kind of see if you have nodules growing in the area. And so the big one that you'll take is synthetic T4. You can make T3 from T4, so you just need the T4 hormone. The major one is going to be called Synthroid or levothyroxine. And interesting enough, a lot of drugs, you can always take the generic version, but for some reason, Synthroid seems to work better than generic or the bioequivalent drug. And this is particularly true if you had congenital hypothyroidism. It's not so much true when I looked into it for the ones you develop later in life, but it's just an odd kind of finding because usually you can buy the cheaper generic brand. And again, as far as massage, if they did have cardiovascular disease, it could affect the massage therapy decision. So you'd have to work with the doctor if it was late stage like that. But massage is unlikely to change thyroid function, but you can manage some symptoms. Moving on then, we have metabolic syndrome. The definition is basically a group of problems that are going to predict the risk for type 2 diabetes or cardiovascular disease. So basically, we're looking at obesity and all the downstream effects that happen from having obesity. As you can see here, in the 1960s, about 10% of the US population or adults between ages 20 and 74 were obese. Once you got to about 1980s, it started to go on a steep rise. Where in 1999, we were at 27.7%. And now, 2010, we're at 35.9% are obese, with projections of 2030 being 50% or half the adult population being obese. And obviously, this has a lot to do with our westernized diet of high fat, high sugar food. More high sugar, it seems. But demographics is going to be 30, as we just said. But increased risk with your BMI or your body mass index. So every time you go to the doctor, they're going to look at your weight, look at your height, and see where your BMI range is on as far as the averages with the population. So the 5 main features of metabolic disorder is going to be a high fasting blood glucose, so high blood sugar. Abdominal obesity, so if your waist measures 35 inches for women or 40 inches for men. And as we're going to see when we talk about obesity, particularly abdominal obesity is what you want to be worried about because that's where all your organs are, and that's going to cause problems as opposed to fat stored elsewhere on the body. Elevated triglycerides, so fatty acids in the blood. Low levels of HDL cholesterol. HDL is considered the good cholesterol. LDL would be the bad. There's different types of LDL, which we won't need to get into. And then the 5th one is going to be hypertension. So if you have high blood pressure, in this case, the book says 130 over 85. Used to say 140 over 90, but again, average or a good blood pressure, they consider about 120 over 80. So anything over that, they're going to start to be concerned about. Again, as we were saying with central obesity, we talk about apple or pear shaped. So apple shaped means you have kind of that classic belly gut, whereas pear shaped is where you carry the fat on your hips. So you don't have any organs down here, so it's safer to store your fat in your hips. So pear-shaped would be better than apple-shaped in this case. Other components are going to be silent, less tested for. You can have, with obesity, you're going to have higher levels of inflammation. So you can look for something called C-reactive protein. More C-reactive protein, the more general inflammation you'll have in the body, which is just not good overall. So if you hit 3 or more of those 5 classic diagnostic criteria, they're going to say you have metabolic syndrome. So treatment is going to obviously be increased physical activity and try to lose that weight. And again, as much physical activity as you want to do, losing weight is really going to come down to your diet and controlling how many calories you're intaking. Obviously, physical activity is going to be part of that, but you can't keep exercising and eating the same. You're just not going to see the results you're looking for. As well as any bad habits like smoking or drinking are going to inhibit progress as well. And lastly, we're going to look at thyroid cancer. And again, with cancer, we're talking about basically changes in the DNA of these thyroid cells. But it's going to be mostly slow growing, and that means it's going to be highly treatable. There are some that are more aggressive, but in general, thyroid cancer is easily treated. So here again, you can see the tumor. With demographics, about 23,000 diagnoses in the US a year, mostly people 40 and over. Again, women 3 to 1 compared to men. We don't really see, but again, with cancer, it's just going to be changes in that DNA, which causes the cell growth to become disorganized and uncontrolled. So risk factors, again, if you have radiation in the area, that could cause DNA changes or genetic predisposition. But what's really important to know is just because you have thyroid nodules doesn't mean you have thyroid cancer. So when they feel your neck or they do an ultrasound and they see these nodules growing, that doesn't mean you have cancer. they're just going to want to keep checking to make sure it doesn't develop into cancer. There's going to be different types. We don't need to worry about these, just have them for completeness sake. But with a lot of cancers, again, it's going to be silent until it becomes more prominent in the later stages. So you might see a painless enlargement of the throat, again, could resemble goiter, pressure on the trachea and esophagus, and symptoms related to metastasis. So if the cancer starts to travel to other areas, then that's a more serious problem. You'll have other symptoms as well. So as far as treatment, they can either surgically remove part or all of the thyroid. Again, not that big of a deal because we can just give you supplemental hormones to make up for what will be missing. Also, they can do that radioactive iodine, where basically they give it to you. And as far as I can tell, you can't target the cancer in particular, so it's going to end up killing the majority of all of the thyroid cells. So that whole thyroid is probably going to be destroyed. So it's just another way of kind of taking the thyroid out of the picture. And then chemotherapy agents could do the same like with other cancers. So if it started to spread particularly. Again, with massage indications, you're working with a doctor in this case. So no massage until radioactive iodine treatment is complete. And with most cancer massage, it's going to be comfort or palliative. And some other quick pathologies. We have acromegaly. Megaly means large. Acro is going to mean the peak, like an Acropolis. So in this case, the acromegaly, your hands and your face and your feet are going to become enlarged. You have excessive growth, particularly in the hands and the jaw. So this is going to be caused by a slow-growing benign tumor on the pituitary gland. It's going to be similar to that gigantism that we saw. It's just going to be kind of more localized. But it can lead to osteoarthritis, high blood pressure, and heart failure. So with any pituitary tumor, you're going to need to get removed to prevent excessive hormone release. Not common. I've never seen somebody in particular. You have Addison's disease, and this is going to be when the immune system destroys part of that adrenal cortex. When you don't have an adrenal cortex, you're going to have a decrease in the amount of cortisol, aldosterone, and androgenic hormones that the cortex usually releases. A picture of JFK because he was said to have suffered from Addison's disease. So signs and symptoms, you're going to have muscle weakness and fatigue, as well as depression, and then patches of darkened skin in the mucus and part of the skin. So like your gums are going to look black in some of these patients. So treatment, again, we're going to supplement the hormones that you're missing. So they're going to give you steroid supplements. So this means for massage, if somebody were on steroid supplements, you would just be careful of any side effects of those steroids. Steroids can cause a thinning of the skin or a weakening of the ligaments. So you'd be careful with stretching or maybe doing more of a dry massage with less lotion. You'd want to be careful because you won't want to tear any skin. So more lotion in this case. And then conversely, the opposite of Addison's disease is going to be something called Cushing's disease or Cushing Syndrome. And this is when you have a high levels of cortisol. So you have endogenous, the ACTH or the adrenocorticotropic hormone. Those levels are going to be abnormally high, stimulating that cortex to release too much. So signs, you're going to have fatty deposits around the neck and the face. So this is what's actually called moon face. You'll also see this in people that are taking steroid medications. They'll put on these fat deposits. The arms and legs are going to become thin and weak. And you're also going to have bone thinning and fragile skin. So it's very common to see very severe stretch marks in some of these patients. So you have connective tissue breakdown. Again, being careful with massage not to cause any more damage to the skin than necessary. So treatment, a lot of times, Cushing syndrome, to develop on your own, it's like a 1 in a million case. I was tested for this because of my issues. So it's very rare to find Cushing syndrome. So again, you're going to find it more on people that are on steroid medications where their doses are too high. So they might have to lower or change their steroid dose. If they did have a tumor on the adrenal glands causing the release, they would remove the tumors on the adrenals. And then you can take meds that counteract cortisol. So as far as massage, again, these are people who are at higher risk, so you're just being more careful and for safe body work, as we said last slide.